Okay, so welcome back. Good morning to all of my dear viewers. And in today's session, we are going to discuss a very important topics of forensic medicine. And the name of topic is the difference between the dying declaration and the dying deposition. Okay, so before we are going for the discussion of the difference between the dying declaration and the dying deposition, I would first like to I'd first like to talk about what is the meaning of this dying declaration and the dying deposition, and in which condition we conducted this record. So this both dying declaration and the dying deposition are conducted in a situation where the victims having a severe injury or the severe illness, and they had a situation of about to die. So if any victims having a severe injury or the severe illness, and they had a situation of about to die, in that condition we conducted dying declaration or a dying deposition. Both dying declaration and the dying decomposition is basically a written documentation that is recorded in case of a severe illness or a severe injury, when when a victim is in a very severe situation, and mostly it is about to die situation. So these are the condition in which we conduct the dying declaration, or we record dying declaration or the dying deposition. Okay, so what is the, now we are going to discuss what is the difference between these two. So the first difference is that the dying declaration, it is follow in India, while the dying deposition is follow in the USA. So in India we not follow the dying deposition. In India we only follow the dying declaration. So this is the first point. What is the next point? The next point is that in case of a dying declaration, anyone can record the statement of victims. In case of dying declaration, anyone can record the what? The statement of victims. But in case of dying deposition, no anyone can record the. It is only recorded by the executive magistrates. So second point is what? Dying declaration is recorded by anyone, but the dying deposition is recorded exclusively by the executive magistrate. Okay, so this is the second point. The third point is that this dying declaration, there is no any need of accused and their lawyers. But in the case of dying deposition, it is recorded only in the presence of accused and his lawyers. Basically, this dying deposition is a full-fledged court procedure. So that's why it is also known as the bedridden court procedure. So this dying, in case of the dying deposition, the statement of victim is recorded in the presence of accused with their lawyer by the executive magistrate. So here executive magistrates record the statements of the victims in the presence of what? Accused and his lawyers. It is since this dying deposition is a full-fledged court procedure. So in case of the dying deposition, there is a possibility of cross-examination or oath taken. So both oath taken and the cross-examination is conducted in case of the dying deposition, but these two things are not conducted in case of the dying declaration. Okay, so what are the next things? The next thing is that in case of the dying declaration, if the victims are survive, then its value get reduced. The value gets less, or it is basically act as a corroborative evidence. While in case of dying deposition, even the survival of victims, there is not a reduction in its value get retained even victims are survived. So what is the next things? The next things is the role of doctors. So what is role of doctor is only in case of what? Dying declaration, because in a case of the dying deposition already the documentation is written by the executive magistrate, so there is no any role for writing the statements of victim in case of the dying deposition. So what is the role of doctor in case of dying declaration? The first role is that doctor have to stabilize the patients, then inform the police. After informing the police, what they do? After informing the police, they check the compos mentis. Okay, so what is this compos mentis? Compos mentis means they basically check that a victim is well oriented to time, place, or person or not. If the victims are not oriented to time, place, or person, in that condition, this dying declaration is invalid. So before recording the statement of victims, the doctor ensures that the victims are well oriented to the time, place, or person. So after this compos mentis, they write the statements of victims in their own words, and after they take the signature of victims, and finally they put these documents in envelopes and send to the executive magistrates. So these are basically the role of doctor in case of what? Dying declaration. Suicide note is also considered as a dying declaration, and on this basis the relatives of victims can file FIRs. So these all are about the difference between the dying declaration and the dying deposition. Now we go for the reading section. So what is the meaning of this dying declaration? It is recorded for a person who had a severe injury or illness and they are about to die condition. The same thing is applicable for the dying deposition. So now what are the difference? The first thing is that it is recorded by anyone, but it is recorded by only executive magistrates. Follow in India, follow in USA. Here just record the statement of a dying person without any presence of accused and his lawyers. So in case of a dying declaration, there is no any need of the presence of accused and his lawyers. But it is a full-fledged court procedure, full-fledged court procedure at the bedsides, also called as the courts of the bedside. So here the presence of accused and its lawyer is necessary. So after that there is no need of the cross-examination and oath, but here it is a full-fledged court procedure. So the administration of oath and the cross-examination. The next thing is that if the victim is survives, they lose its value and they only act as a corroborative evidence. Corroborative evidence means less value evidence. So if in case of the dying declaration, even after the survival of victims, it retain its value. So they having a less value, it having a more value. Not any role of doctor, no follow in India. India will not follow the dying deposition. So what is the role of a doctor? First, they stabilize the patient, inform the police, check the compos mentis, I mean a person is well oriented to time, place or person or not. Then record word to word statements, signature of victims, send the declaration to the magistrate in a sealed cover, and the suicide note is also act as a dying declaration. So this all about the difference between the dying declaration and the dying deposition. I hope you can understand the lecture. Welcome back in new session.